Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some questions about senior dental care. What is senior dental care and how does it differ from routine dental care? So they're both very similar, but when we come to senior dental care, just consider some more elevated level. So, as we get older, our body changes, lots of body changes happen, and sometimes we do get some different kind of health problems, and those health problems might be requiring you to take some sort of medications like constantly. Sometimes we see some of our seniors might be taking ranging from one medication every day to I have seen as many as 20 medications. And as we know, all that have different kind of effects they produce on all of our body parts, including our mouth as well, to our oral cavity. So because of that, depending on what medications you are taking, what kind of health conditions our senior might have, the level of the health care, dental care, the routine care for them that they're going to be needing to make sure that their gums stay healthy, their teeth stay healthy, their oral cavity stays healthy, and also because of that, if there's any disease going on in the mouth, is going to in turn impact their other systemic health too. So as I said before, it's more of a laser focused and also more elevated level of care that our seniors require compared to a healthy teenager or a healthy young adult, which does not have any other systemic conditions going on. What common challenges our seniors face as they age? So a few challenges. One of the very common ones, as I just touched upon in the previous topic, is that based on the medications that they might be taking or the health conditions they might have, it really sets them up or makes them a lot more prone to having dry mouth, which is basically your glands are not producing as much saliva as they normally should be. And because of that, it puts them at a very high risk of developing cavities, because just think of that, saliva is actually acting as a natural agent to wash off some of the bacteria and the bugs that can stick on our teeth. So when that is affected, those bacteria, those bugs are free, they stick on your teeth longer, and that leads to cavity formation, that leads to gum inflammation. So that's one of the big factors, is that when they're taking medication or from their systemic conditions leading to dry mouth, reduced amount of saliva in your mouth. Or other effect that we see in our seniors is that because of that dry mouth and more development of cavities in their mouth, they might have some existing crown work or bridge work or even other fillings in their mouth, or even on the natural enamel, we are seeing more increased amount of cavities in their mouth, which leads to them needing to redo their work, or sometimes if the cavity is so extensive that they might need to get the tooth taken out, and then hence leading to replacement options and all that. So that's how that the effect gets kind of almost like a snowball effect. It just kind of like goes in circle. One thing leads to the other. What kind of procedures are most common in our senior patients? A few of the most common procedures that we see in our senior patients are need of dental implants or bridges or dentures. But we can prevent that, again, as we talked a bit before, by making sure that we are managing what is needed for your particular case based on your health history, medication that you're taking, and the risk you are at by doing routine preventative care. Whether it's you needing to come for preventative cleanings every 6 months or 3 months or 4 months. And also a big factor is that we can use for prevention, again, it's preventative process or preventative procedure or a product, is utilizing the fluoride applications. So that way we can protect our teeth and prevent the cavity formation and tooth loss, hence leading to those most common procedures that we see our seniors need, those treatments for implants and crown work or denture work or bridges. What should seniors and their caregivers should know when exploring a dental insurance? So dental insurance mostly actually, it's a dental benefit that you get certain amount of money to utilize towards your needs. And it may or may not cover the needs you have. So that is one very basic thing to keep in mind, that it's most of an umbrella coverage that a plan provides, it may not be sufficient for what you need. But if you're exploring the options, some things to keep in mind would be that, most likely you're going to be buying that plan on your own. It's not going to be something that, if you were working, if our senior was working and their employer is still giving them that option. So most of those plans are you're helping out, a caregiver might be helping out the senior to pick a plan. So when you look into those plans, so here are a couple of things that we can look into is that making sure that how much annual they are going to give you, provide you. So dental insurances, they provide you an annual maximum amount that you have to utilize towards what your needs are. So it's not an unlimited amount. That's one very big thing to understand, is that it's not an unlimited amount. It's a certain amount, could be $1,000, $2,000, $1,500. It can vary from plan to plan. So that is one question that you can ask the carrier, is that what is the annual maximum amount they are going to provide with this policy or this plan. Some other questions might be that, what services do they cover, like regular cleanings or some treatment cleanings or crowns or bridges or implants or dentures. If you have any idea, or your dentist has given the idea that the patient might need those kind of treatments. And other could be asking them what percentage do they pay those procedures at. Dental insurance in general is a very complicated subject, but hopefully this couple pointers will help you understand asking some of the questions when you are picking a plan for your loved one. What should patients consider when looking for a dentist for senior citizens? So a couple of the things to consider would be making sure that the dentist and the team, the provider, hygienist, and could be any other specialist, which if they have on their team, that they're well versed and trained on diagnosing the conditions that could be present in seniors' mouths, and also treating them, whether they're treating in their own office or whether they are helping you set up a specialist. So making sure that they are well versed and trained with diagnosing the conditions and providing you the treatments. And also equally important is helping you educate and learn and also apply preventative tools and really helping you how can we prevent those conditions from happening later on. So things to consider would be, as we just talked about, is being able to diagnose, help you with what's going on in your mouth, why did that happen and how can we prevent that, and being able to treat that condition, and also being able to prevent that from happening later on, giving you some options for what can be done, how could you be made at less risk of developing that in the future and treating that now. Are there any senior specific programs to help them afford their treatment? Yes, there are a few options that are available, and lots of seniors have used those options to help them afford their treatment and get healthy. There are offices where in our office we do offer some of the programs that are within our practice, and also there are programs which come through third-party financing companies which help seniors to afford their dental treatments and get healthy. What advice I have for our seniors to help them plan long-term dental health? The biggest advice is that go for prevention. Make sure that you're seeking care routinely. As we know, nowadays with the diagnosing abilities we have, being able to use the technology, we are so able to prevent things when they start. So that would be my biggest advice, that make sure that you're seeking dental care regularly, you're getting your regular dental checkups, you're getting your regular dental cleanings regularly, and then diagnosing and preventing problems from happening, being able to diagnose very quickly and get those problems solved, get those treatments done, because as if they are not taken care of, they become more extensive and expensive. So we want to avoid that for you guys. So make sure that you're seeking, again, you're going to your dentist regularly, getting routine checkups, routine cleanings, and if you're at a high risk because of certain conditions, as we talked before, whether it's medications you're taking or it could be general health conditions, and you're utilizing the programs and treatments we have available, whether it's fluoride at home or fluoride when you come to the office. So again, really going big after prevention and routine care. So those two are the biggest advices I have for our seniors. I hope I was able to answer some of the questions about senior dental care. And if you have any other questions or you need any help, we are here to help. Please do not hesitate. Call us at 603-926-8827 and we'll be happy to help you out. And if you would like to go to the website, you can go to our website, www.smilesbythecnh.com. You can read certain things about from our website, and you can also request an appointment, and we'll be happy to help you.